All right, ladies and gentlemen, joining me in the studio now is Mr. Matt Patterson. He's health policy analyst for the National Center for Public Policy Research. Mr. Patterson, welcome to the show. What's, from the perspective of the physicians, what is this going to do to them, assuming that it withstands constitutional attack?
Well, I would say the answer to that is we don't know fully, but we definitely know what the doctors think will happen. Doctors have been following this very closely for a year. They're very educated and informed on this issue, obviously. And in several recent studies, there have been some very disturbing findings about how physicians feel this legislation will affect their careers. The latest was done by a firm called the Medicus firm. They interviewed and surveyed over 1,000 practicing physicians, all career levels, different stages in their career, different specialties. And what they found was that these doctors overwhelmingly fear that their income will go down under this legislation, their workload will go up, their red tape will go up, their overhead will go up, and as a result of this, I'm sorry to report, 46% of practicing primary care physicians say they will either quit medicine or try or think about quitting medicine if this legislation becomes law, which it looks like it will.
It looks like it will. Well, one can understand that if they're going to add to the patient load 30 million people. There's no increase in the physicians, and there's some physicians right now who, because of the severe underpayment by Medicare, will not treat Medicare patients. How many of them would just say, I won't take Medicare patients?
Well, already, as you just said, Medicare patients are having a hard time finding, especially primary care physicians.
And those are the ones that are most, the biggest shortage of any is in primary care.
That's exactly right. We already have a primary care physician shortage. In the last 12 years or so, the number of medical school students going into primary care has dropped over half, over 50%. So we already have a small pool of primary care physicians. And I think what's going to happen is two things. First, doctors who might not have considered retiring now might just consider that as an option. So you might have a wave of retirements. Second, medical students in the school today are going to be looking at their career under Obamacare, and they're going to ask themselves, is this a line of work that's really worth my time? You know, you're talking about almost a decade of training and schooling.
And a tremendous education expense.
I mean, these medical school students, they put themselves into debt, sometimes in the hundreds of thousands of dollars.
And then there's the 6 figures annually for liability insurance, because there's, in this new law, there's no cutback on the abuses of tort.
And you hit it on the head. You know, some of these specialists, neurologists and whatnot, they pay hundreds of thousands of dollars before they can turn on their lights and just medical malpractice insurance. So the medical profession in toto is going to look at this and say, look, if this isn't worth my time, if I can't make a living after all these sacrifices, I might just find another line of work. And there's plenty of work for,
well, sure, they can become research physicians for pharmaceutical companies or something like that.
Consultants, absolutely. I mean, what we have to understand is doctors, like all human beings, respond to incentives. And if you make it harder for someone to do something, they're going to do less of it. I mean, that's just human nature. And, you know, you brought up Medicare. That's very important. I don't think people, the majority of the population, really understand the crisis that Medicare is in. You know, I wrote a paper on this a couple weeks ago. We already have government health insurance. It's called Medicare, and it's going bankrupt. They're not paying the physicians enough to cover their costs. Physicians are opting out of Medicare. Seniors in rural areas are having a hard time finding doctors who will treat them. And there's just not enough money to keep this going. And on top of everything, on top of all the insults that this Obamacare piles onto this country, they're going to cut Medicare by almost $500 billion. It's hard to fathom.
You know, what I don't understand is the Obama position that if we add to the load of Medicare by 30 million and then detract $500 billion from the financing of it, that somehow or other, that's gonna improve things.
Well, it's like
Doesn't make any sense.
I like to say, you can believe that this legislation is a good thing. All you have to do is ignore three things: human nature, economics, and all of recorded history. If you can ignore those three things, then this legislation is great. It's going to lower costs. We're all going to be covered. There's all going to be everything you want will be done. You know, any test you want, and it's just insane. And you know, you made a good point. Half of this newly insured 30 million pool are going to be shuffled off into Medicaid, which is already, it's another government program that's going bankrupt. You know, there's just these new stores are now refusing, or claiming they're going to refuse to take Medicaid.
Well, the fact of the matter is, if you take Social Security, which for the first year is now paying out more than it's taking in, and there's no money in the trust fund, it's just a bunch of IOUs, so they have to be made good on. And how do you do that? You've got to raise taxes on it. So you've got Social Security, you've got Medicaid, you've got Medicare, you've got Medicare Part B, all those things, huge unfunded liabilities in the trillions of dollars that we do not have. And I would suggest to you that as we speak, the country is bankrupt. I mean, if China ever says, you know, I want the money that is represented by these bonds that I've purchased, what do we do?
Yeah, I mean, you're exactly right. It's hard to understand, but we can't make the promises we've already made. We just can't. There's no money. And now we're creating another $1 trillion entitlement. In my opinion, what we have just done is signed an economic suicide note. We don't have the money for this. We're going to hasten the demise of Medicare. We're going to drive doctors out of business. That's going to cause shortages, rationing, long waits. Taxes are going to go up. Taxes on businesses are going to go up. Caterpillar just announced this bill will cost them $100 million the first year. You don't think that's going to translate into lost jobs?
Well, sure.
Into pay cuts?
They're going to take the manufacturing that they do for their heavy equipment and perform it in some other country where they don't have to undergo this expense. I mean, that just makes common sense.
They're going to try to cut costs any way they can, and you know, that's just the first. I mean, there's going to be a wave of companies deciding how many employees can we afford under these regulations. I mean, this is an enormous burden that they are going to bring down on our doctors, on our businesses, and on the health insurers, which the Obama administration wants to demonize, and I'm afraid that they're going to have a hard time staying in business.
Well, they're essentially going to be public utilities that are regulated by the government.
Exactly.
And I'll tell you who this is going to be a good deal for. As government employees, there's going to be 16,500 new jobs just in the Internal Revenue Service alone, whose task it will be to chase after you and everybody you know to make sure that you have purchased government-approved